When the Herbert Wertheim School of Public Health and Human Longevity Science was established on September 19th of 2019, we knew that we would need to center the values of our school around justice, equity, diversity, and inclusion, because we're living in the 21st century, and the schools of public health of this time really need to be relevant for the issues of public health in this time. Systemic and structural racism has been a public health crisis for decades, and now more than ever, an American conversation, a global conversation, is happening around these issues. And everyone who works or trains in public health should be prepared to participate in that conversation productively. Joining me to discuss our plan for fostering a more just and healthy world is our Associate Dean, Dr. Sonia Jain, who has led our working groups to figure out how our school will strategically position itself to engage with justice, education, diversity, and inclusion in our educational efforts, our research efforts, as well as our community and academic partnerships. In the first year of the School of Public Health and Human Longevity Science, we saw systemic and structural racism catapulted into the public eye through events like the murder and death of George Floyd, through our racism against Asian Americans and Asian nationals. And we really want to be positioned in this school to be a part of those conversations and a part of the solutions. So, Sonia, how do you think these events shaped our school's strategy?
Oh, without a doubt, Cheryl. The events from 2020, we were in the middle of a pandemic, and then with these very serious and frightening racial conversations that occurred while we were just starting to form our school as an anti-racist institution, it absolutely laid the groundwork for how we started to think about what we should do as a school in terms of addressing some of these public health inequities.
So what steps are we taking in the Herbert Wertheim School of Public Health to improve access and success for the constituents of the school?
Well, we have done a number of things in the last year. We offered a wonderful 24-hour racial resilience seminar series that is now being followed up by a new circle of compassion, which we're calling the Compassion Action Circle, which we're launching this month. We've also started 2 new faculty searches in terms of advancing the faculty diversity in public health equity. We are also trying to offer scholarships, diversity fellowships to students in the Masters of Public Health program. So we've been doing a number of things in the school, as well as trying to foster a very enriching and nurturing environment for our students, our staff, and our junior faculty.
Yeah, so Sonia, what impact do you think these efforts that we're engaging in the School of Public Health will have on the health of our local San Diego community and our region?
Well, I think the main thing is the first thing we have to do is train our students to be able to communicate with the community and engage with them in areas, especially areas of border health, COVID-19, the migrants and refugees. So I think our first step in our school has been to create that fostering environment in the classroom and teaching them to get out into the community.
Yeah. In addition to us wanting to have a school where our students feel like they belong, we want to have academic partners who, when they come into our school, they also feel like they belong, right?
Absolutely.
So how do you see health disparities and health inequities and social justice being addressed within the School of Public Health?
Well, I think that we have a number of community partnerships. We have a number of internal partnerships at the school. And so I think that we are addressing issues of poverty, food insecurity, and of course, the elephant in the room, COVID-19. And our students, faculty, and staff have been engaging in these conversations about COVID-19 and the health inequities that affect some racial groups, and as well as some geographic locations in the country and in the county.
Yeah. Well, justice, equity, diversity, and inclusion, they're a cornerstone, not just at the Herbert Wertheim School of Public Health, but really on our entire UC San Diego campus, where the academic environment encourages us to follow our intellectual curiosity. As a follow-up, we pursue opportunities to really make an impact in our community. So here at UC San Diego, we recognize that true excellence is achieved when we feel respected for our various perspectives, background, and heritages. And we should all feel included in campus life and experience equitable opportunity in achieving our aspirations. So the School of Public Health really is sitting in a larger community for which justice, equity, diversity, and inclusion are a foundational issue. And we thank our JEDI, Associate Dean, and Dr. Sonia Jain.
Thank you so much.